A 62-year-old male patient, A, had enjoyed drinking alcohol throughout his life, typically 1 bottle of vodka a day. One day, he noticed that his face had turned yellow and his stomach was swollen. After visiting the hospital, he was diagnosed with end-stage liver cirrhosis. The only way to save his life was a liver transplant. A's eldest daughter willingly agreed to donate part of her liver, and he received the transplant. However, after his health improved, A began drinking again. Before long, his skin turned yellow again and his stomach swelled up. Medical tests confirmed that his cirrhosis had progressed again due to alcohol abuse. The only treatment option once more was another liver transplant. Fortunately, A's second daughter also agreed to donate part of her liver and he received another transplant. But once again, he started drinking after the surgery. Dr. B, who had strongly advised A to quit drinking from the beginning, became frustrated after repeatedly witnessing the patient's non-compliance. As a result, Dr. B informed A that he would no longer provide treatment. Is Dr. B's decision problematic?
When doctors treat patients, they inevitably encounter many different types of people. Some patients verbally abuse or insult nurses, sometimes even committing sexual harassment or assault. Others interrupt the doctor repeatedly, or only insist on saying what they want, wasting consultation time. Some get into arguments with nurses in the waiting area or even overturn chairs. These patients make consultations extremely long and stressful. So, can doctors refuse to treat such patients? A doctor's refusal to treat means that the doctor decides to end or deny the treatment relationship regardless of the patient's wishes. Even if a patient freely chooses a doctor, makes an appointment, and then cancels it, no one considers it a problem. But when a doctor refuses to treat a patient, many people think it is problematic. Let's look at a simple example. When we buy goods or services, both buyer and seller have the freedom to enter or end a contract. This is known as the principle of freedom of contract or private autonomy. If a customer wants to return a carton of milk, they can express their intention and the contract is terminated. Likewise, if the store owner refuses to sell milk to a particular customer, the transaction ends. Both sides have the right to make or end the contract. From this perspective, medical treatment can also be seen as a private contract between a patient requesting treatment and a doctor agreeing to provide it. A doctor's refusal to treat can therefore be understood as the doctor unilaterally terminating this treatment contract. So, should doctors be allowed to refuse treatment? Unlike milk, which can be purchased at supermarkets, convenience stores, or big box retailers, medical care is different. Medical services can only be provided by licensed physicians, and access to specialized care at major hospitals is more limited. If doctors are allowed to freely refuse treatment based on the principle of contract freedom, patients in urgent need may have their lives put at risk. For this reason, in most countries, doctors are not allowed to refuse treatment freely. In some cases, refusal may even lead to criminal penalties. However, if doctors are not allowed to refuse treatment under any circumstances, they must treat patients who harass or assault medical staff, or who are entirely uncooperative. This creates serious burdens on both doctors and healthcare workers. Doctors are also human, and emotional conflicts or breakdowns in trust can occur. Forcing treatment in such situations can be problematic. Moreover, unlike large hospitals, patients can easily go to another private clinic nearby. Thus, restricting refusal of treatment only for large hospitals may not cause significant issues for patient access. In fact, Korea and Japan are the only countries with broad legal prohibitions on treatment refusal. Japan, however, has no penalty provisions. However, in United States, private physicians may refuse treatment in non-emergency situations if it does not harm the patient's health or worsen their condition. In United Kingdom, doctors may refuse treatment if the patient engages in violence or threats. In Germany and France, physicians may refuse treatment for professional or personal reasons, except in emergencies or when humanitarian needs are involved. In these countries, treatment refusal is seen as part of professional ethics. and regulated through medical ethical guidelines rather than strict laws. What do you think about doctors refusing to treat certain patients? Share your thoughts or opinions in the comments below.